So here's a video for my clients who I've shown a trigeminal nerve release for headaches or face pain or jaw pain. Before you start, remember to wash your hands. Anyhow, so you can start with just running your hands along the orbit here, and then you'll find a tender spot. And so you can push it and you find it's tender, and then just back off so that you're still holding it, but it's not too tender. And then you're gonna roll it to see which way it moves easier. So you're gonna roll it this way, and then you roll it the other way. So it doesn't wanna go to my right. So I'm gonna take it along the orbit to the left and wait for it to release. And I felt it release, and then I'm gonna take it over towards my right side, and then it's releasing. And then we can do the left side. So you find the tender spot, see if it goes along the orbit to the middle, towards your nose, or to away. So mine goes towards my nose, and I'm gonna wait for that to relax. And I feel it relax throughout my body, and then I'm gonna take it to away from my nose. So that's one spot. Then those ones, they actually come up and over your head, and they meet a nerve that comes from your first and second vertebrae and come up, and both of those can compress your head. So this one is also very good at releasing any of your bone, your head bone sutures. So, and you can take it and roll your skin across. Mine is pretty tight. And these you can do repetitively throughout your day, and then your head can sit more level on its spine. And then as you keep doing it, it gets better and better. So then there's another one. If you keep rolling over, there's another spot where you'll feel a little divot or a little tender. And then we do the same thing along the orbit. So we see if it goes towards the middle of your face or away. So it likes to go towards the middle of my face. So I'll take it that way, and then I'll take it the way it doesn't want to go. And then I'll do the other side. Here. And so I'll see if it goes towards the middle or if it goes away. This one prefers to go away, so I'll take it there first, and then I'll take it to the middle. Okay. So then there's two more spots. So if you run along the orbit and then you hit another spot where there's like a little groove or a tender spot, mine is just more of a groove. And then I'll do the same thing. So see if it likes to go up towards the eyebrow or down. It prefers to go down, so I'll go down first, and then I'll bring it up. And then I'll do the right eye. So here it is. See if it wants to go up or if it wants to go down. So it wants to go up. And I'll take it, go down. And then there's one just kind of underneath it. So I want to see if it goes up or if it goes down. It prefers to go up. So I'm going to take it up, and then I'll take it down. And then over here, so I'm going to see, oh, this one likes to go down, and then I'm going to take it up. And then there's one, if you kind of go along the bridge of your nose, and then you'll feel it's like a tender spot. And then we take it towards the middle. And mine prefers to go towards the middle, so I'll take it to the middle, and then I'll take it away. And then I'll run my hand on the other side, and see, mine just likes to go towards the middle, and then it doesn't like to go to away from the midline of your face. So that's the trigeminal nerve. There are some spots actually that are really pretty good that are up along here, but you could, if you find the tender spots, and then you put your finger on either side of the tender spot and make it move from side to side. Just looking for tender spots along the side of it, just kind of above your ear. And so you don't push on the tender spot. If the tender spot's here, you put your fingers on either side and you can see if you can get it to move. So checking which way it likes to move first and going to the other side. Okay, and then you could do the left side. So just imagining there's nerves that come up, and then you're finding the tender spot and just making sure it goes the way it wants to, and then it goes the way it doesn't want to. So that's the trigeminal nerve release. Good for jaw pain, headaches, face pain, sinus issues. Okay, thank you. Oh, check out my blog on it's winnievalenciaphysiotherapy.com, and I have a little blurb on the trigeminal nerve.